The nurse and the language of instruments. Everyone at the teaching hospital admired Nurse Asa, not only because she was beautiful, but because knowledge flowed from her with ease. Her presence made learning feel calm, and her voice turned complicated lessons into simple truths. That morning, Asa stood before a group of student nurses in the skills laboratory. A stainless steel tray lay before her, neatly arranged with shining instruments. She smiled, adjusted her cap, and began. "Today," she said gently, "you will learn the language of instruments, because caring for a patient begins with knowing your tools." She lifted the thermometer first. "This measures body temperature," Asa explained. "It helps us detect infection early." Next, she held up the stethoscope, resting it around her neck. "With this, we listen to the heart, the lungs, and sometimes to what the patient cannot say." The students leaned closer as she picked the sphygmomanometer. "This checks blood pressure. It tells us how hard the heart is working." Asa moved on to the syringe and needle. "These are for administering medications and vaccines. Precision and gentleness matter here." She raised the catheter carefully. "This helps drain urine when a patient cannot do so on their own. Always remember, dignity is as important as technique." The forceps followed, used to hold or pick sterile items without contamination. Then the kidney dish, for holding dressings, instruments, or waste during procedures. Finally, she pointed to the gloves and face mask. "These protect you and your patient. Safety is love in practice." When she finished, the room was quiet, not from fear, but from respect. Asa wasn't just teaching instruments, she was teaching responsibility, compassion, and professionalism. As the students applauded softly, Asa smiled. "Beauty fades," she said, "but skill, knowledge, and kindness save lives." And in that moment, many decided they didn't just want to be nurses, they wanted to be Nurse Asa.